ठीक है सर. Ajay Agarwal will be speaking on integrated people-centered eye care for tackling blindness due to glaucoma. LC Badaria sir, and I is here. Next is yours.
Okay. Good morning to the panel on the dais and off the dais, and thank you, Dada, for including me in your session. So I shall be talking about integrated people-centered eye care for tackling blindness due to glaucoma. But before that, I have no financial or proprietary interests. So this is the outline I shall be talking upon. And we all know that a large percentage of people, 2.2 billion people, have some sort of visual impairment. And half of those have impairment which can be prevented. Out of this, 76 to 80 million people are living with glaucoma, which is a very big percentage. And more than 75% of the visual impairment is avoidable, which is blindness, which could either be treated or prevented by known cost-effective means. So glaucoma is the second leading cause of blindness and the third leading cause of visual impairment worldwide. So it is projected that by the year 2030, there would be 95 million people with glaucoma. And as of now, 3.2 million people are blind due to glaucoma. So we talk about cataract all the time, but Andre Mahmood has said, then when you look at 1 million people, you will have 10,000 cataracts every year. And at the same time, you will have 10 to 20,000 who will have chronic glaucoma as well. Out of the total 76 million worldwide, Asia, there are 45 million. And if you look at China and India together for almost half of the visual impairment. So worldwide, 1/5 of the global burden of glaucoma is in India, with an almost equal proportion of closed angle and angle closure glaucoma. And as per the largest study, in the urban population, about 2.1% had open angle glaucoma and about 1% had primary angle closure glaucoma. Similar figures in the rural population as well. So when you talk about integrated eye care, it means that you include all aspects of healthcare, not only curative, but promotive, preventive, and rehabilitative for all eye conditions, incorporating eye care in the national planning and policies, and bringing eye care to the people. So when we talk about IPEC, what is people-centered eye care? So it is services which focus on the needs of the individuals. They ensure that the people's preferences are taken into account, and they provide care which is respectful and responsive to the people. And it is about what matters to you rather than what matters with you. So why do we need integrated eye care? That is for planning and financing our health resources to improve health outcomes, the quality of care, and the patient experience. Because in the end, what will matter is if there is good eye health, there is good health and well-being, quality education, and economic growth. And all of this is linked with gender equality and the reduction of the poverty of the country. So how do we put this into practice? Through health literacy, by prioritizing primary and community care services, coordinating eye care services with other health services, and inclusion of the eye care into the health plans and policies. So one of a very good model is the LV Prasad Eye Institute model, where you have vision centers, where you have other centers. So at the basic level, it is the people amongst the population who are responsible for screening out those individuals who have some problem. They report to the vision centers where refraction is done, a basic evaluation, so you can screen for glaucoma there, and then they are referred to the other specialized centers. So that is how it works. And what is the first thing that you should advise to the public is plan for an eye examination. Ask them to look around in the family for those who are vulnerable, get them screened for glaucoma. And so herein lies the role of the vision health guardians and the vision care centers. So early screening and detection is the first step in preserving vision. And for this, the integration of the eye care services with the primary health care is fundamental. So you should advise a regular eye examination, systemic parameters, extremely important, control of weight, diabetes, and hypertension, wearing eye protection, avoiding excessive caffeine and smoking, vigorous weight lifting, certain postures like Shirshasana, which can increase the intraocular pressure. So the take home message is that everyone is at a risk for glaucoma. There may be no warning symptoms. So you need to integrate screening as part of the NPCB VI, because early screening and detection is the first and the most vital step which will help in preserving our vision. So I thank you for a patient hearing.
Thank you, Dr. Agarwal. You have very rightly highlighted points related to glaucoma, which is a silent killer. I always keep telling on various platforms that not only the public, even we doctors should be aware of this problem. We neglect ourselves to regular checkup and getting glaucoma ruled out. And I think you have a point which you have raised to follow the LV Prasad model. That's a wonderful idea. And I would request Dada and all other dignitaries to take into account as to hold as many as glaucoma screening camps and awareness camp as possible to really get rid of this sight-threatening disease, glaucoma. Thank you once again, Dr. Agarwal. Now,